Welcome to Live Up the Show. Your hosts are Garfield Burford and Mitzi Allen. It's the magazine program committed to bringing you news you can use to live up to your full potential. Brought to you by the Caribbean Broadcast Media Partnership on HIV/AIDS and the Caribbean Media Corporation.
I'm Garfield Burford from CBM TV in Jamaica.
And I'm Mitzi Allen from Hammer TV in Antigua and Barbuda. Every month we bring you stories from across our region, stories to inspire you, inform you, and of course, entertain you.
That's so right, Mitzi. And today we have excerpts from a CBMP Awards co-production called Choices from Nerissa Golden in Montserrat.
Then there's the uplifting story of two successful Barbadian brothers whose lives were deeply affected by HIV. In
How I Live Up, we meet a young woman whose positive status, pregnancy and HIV-free baby led to her becoming an advocate for HIV-free births, a worthwhile and inspiring endeavor that is saving countless young lives in Trinidad and Tobago.
All that is coming up. Right now we head to Jamaica.
In Jamaica, it is estimated that 32,000 persons are living with HIV. The highest rate is found in the 15 to 44 age group, which is considered as the most productive of the society. Over 50% of persons with HIV are unaware of their status. Despite this reality, there is no legal reason for mandatory screening for employment purposes, as was highlighted in a May 16, 2011 Gleaner article.
I wrote the article because I had a patient who came to me who was very distressed. She had to submit herself unwillingly to a blood test for HIV and sign a form to allow the result to go to her employer. I thought it was very unfair, and from asking around, she was the only one. It wasn't actually the case. There are others who have the same problem. I understand that some schools do it also, but mainly large companies, and in fact even international companies that should know better. So I felt it my duty to say something in the public in order to try to let them stop doing it.
The Jamaican government does not support screening for employment purposes or for the purpose of promotion. This stance was included in the Green Paper on the National Workplace Policy on HIV and AIDS, which was tabled in March 2011.
In accordance with the policy, we don't support the screening of employees because that would be in contravention of the policy. The policy is in conjunction with the ILO guidelines, which has really 10 points, and one of them is that there should be no screening for the elimination of persons from work because of their status or perceived status.
The principles also include confidentiality. No job applicant or worker should be asked to disclose his or her HIV status or HIV-related information, and no co-worker should be asked to reveal such information about fellow workers.
We've come a far way as a country, definitely, in terms of the number of complaints we get and the type of complaints we get. A lot of the complaints we now get are stigma and discrimination complaints. We also have persons who feel and they allege that they have lost their jobs as a result of their positive status. And so it's always going to be a challenge until we sort out how we relate to persons with HIV and AIDS generally as a country. Even though knowledge is high, a lot more needs to be done with persons' behavior and how they internalize the information, and then how that guides how they treat people who are HIV positive.
I think HIV testing should be mandatory for employment purposes because each employer need to know the status of their employee, so at least they can sensitize other workers about the conditions of persons who are a part of their workforce.
I don't think they should do it because people discriminate against them, and since it has nothing to do with the job, it's definitely a no-no because it cannot be transmitted through work.
No, and the reason why, I don't think it affects the person on the job performance.
We say to companies, don't say you will not hire as a result of someone's status. Work more with your staff to understand the importance of practicing healthy behaviors so that they do not get the disease if they don't have it, and so that if they have it, they practice positive prevention.
The workplace can play a vital role in the wider struggles to limit the spread and effects of the epidemic by actively confronting stigma and discrimination. It is an appropriate setting to involve the working age population in efforts to prevent and control the spread of HIV and AIDS through education and training, counseling, care and support. Tanisha James, CTV, Jamaica.
Thanks, Tunisia. I imagine this discussion will go on for quite a while until there's a greater understanding about the implications of this